Music is always about communicating. It's always about touching people. It's always about feeling. The Music for Health initiative of the Grand Rapids Symphony is our way of bringing what we do to patients and to families and to people working in healthcare settings.
The musicians from the Grand Rapids Symphony are fantastic. They're all great players, and we're very fortunate to have them with us. It provides me with an opportunity to spend more time focusing on the patients, again, similar to doing the outpatient group that we did today. It was nice. It's nice to have the musicians there so that they can play and I can go around and interact with patients to see how they're doing. I can experience the music in different parts of the infusion area, so I can tell if it's too loud or too soft, or if there needs to be alterations in the style or anything like that. Just see how patients are reacting, which I don't typically get to do when it's just me there.
I was very excited to be asked to be involved with the Music for Health program, particularly because I personally have had a couple family members over the last few years who've had serious illnesses and prolonged recovery periods. And the thought of being able to participate in other people's recovery and to assist in making their experience better, make their lives better during that was something that just thrilled me. It was wonderful to have an opportunity to do that.
I think being in this program has really reminded me of what we can do with music, and that we're not just focused on what we usually think of, which is trying to perfect the music we're working on and really going for this one idea of what music should be, but really reminds me that there are other uses for music and other powers that it has over people, not just in the concert hall, but all through our life.
Just the level of interaction I have with the patients is something that surprised me, how much they are interacting with me and how much I interact with them.
I have been so heartened by seeing their progress and their ability to articulate better, move better, and just the engagement generally as a group. I feel like there has been more and more of an excitement in the participants. Like, they know we're coming, they come in and they say things like, "I love the symphony," and I just, when they do that, it's like they remember me, and I feel really, it's charming and wonderful, and very gratifying.
I can't say thank you enough to the Grand Rapids Symphony for being able to come out and work in an environment that was probably quite a lot different than many musicians. I can't say thank you enough to Diane Helle for her imagination and desire in wanting to build something that was unique and unusual, and for just asking that question, if you could have anything. And then, of course, our music therapists, Aaron Wegner and Alika Siu, they just have continued to build ideas for this. I think we have just only started. I'm so excited about what the future holds.